Post-intensive care syndrome, or PICS, is a term that has become increasingly important in modern medicine, especially since the COVID-19 pandemic. As more patients survive critical illnesses in intensive care unit (ICU) stays, clinicians and researchers have noticed a troubling trend. Many survivors face long-term health challenges that go far beyond their initial illness. PICS describes a collection of new or worsening physical, cognitive, and mental health problems that persist after a patient leaves the ICU. These issues can include muscle weakness, chronic pain, anxiety, depression, and even post-traumatic stress disorder. Not only do these complications affect the patients themselves, but their families and caregivers can also experience significant psychological distress. Understanding PICS is crucial for improving the quality of life for ICU survivors and their loved ones, and it highlights the need for ongoing support and research in this area. Effects of PICS are far-reaching and often life-changing. Physically, survivors may struggle with muscle atrophy, chronic pain, or ongoing respiratory and kidney problems. These physical impairments can limit daily activities and independence. Mentally, many patients experience anxiety, depression, or cognitive difficulties such as memory loss and trouble concentrating. Studies show that up to half of ICU survivors still have symptoms of PICS a year after discharge. The impact doesn't stop with the patient. Families and caregivers, too, are at risk for anxiety, depression, and even complicated grief. Financial stress and the emotional toll of caring for a loved one with ongoing health problems can be overwhelming. Children of ICU survivors may also need special support. All these factors combine to reduce quality of life and increase healthcare costs, making PICS a significant public health concern. Managing PICS requires a coordinated, multidisciplinary approach. Early screening for mental, cognitive, and physical problems is essential, ideally starting within 3 months after ICU discharge. However, there are still many challenges. Not all patients have access to follow-up care, and there is no single proven treatment for PICS. Innovative solutions such as digital health tools and remote follow-ups are being explored to improve access and monitoring. Research is also focusing on understanding the underlying causes of PICS, developing better screening tools, and testing new therapies. International collaborations and large-scale studies are needed to find effective interventions and improve outcomes for both patients and their families. Ultimately, integrating PICS management into routine ICU care and research will be key to addressing this complex syndrome and supporting survivors on their road to recovery. Looking ahead, the future of PICS care depends on ambitious research and innovation. Scientists are working to standardize how PICS is measured and managed, promoting international studies and using big data to track outcomes. There is a push to include patient and family perspectives in research, ensuring that new interventions truly address their needs. Biobanking and genetic studies may reveal why some people are more vulnerable to PICS, leading to personalized treatment. As healthcare systems adapt, integrating digital solutions and improving coordination between ICU teams and primary care will be crucial. By making PICS a routine part of clinical trials and care pathways, the medical community can better understand and tackle this complex syndrome, ultimately improving the lives of ICU survivors and their families.